Hello everyone, welcome to Dr. Anna's NCLEX review. Today we are going to talk about an important topic, the anti-Parkinson's drugs, the classification. Firstly, what is Parkinson's disease? Parkinson's disease is a neurodegenerative disease. It is a chronic disorder where the dopaminergic neurons of the substantia nigra basal ganglia degenerates over time. So what happens basically? The dopamine levels go down and the ratio between the dopamine and acetylcholine is disrupted. So there is less of dopamine and a little relatively more acetylcholine. So the drugs are aiming to either increase the dopamine levels or decrease the acetylcholine levels. Okay, so let's first go to the first type of drug. So the first and the drug of choice, the first line of therapy is dopamine replacement. So dopamine by itself cannot cross the blood-brain barrier and has a short T-half. So instead, levodopa, the first line drug, levodopa, the most important drug in Parkinson's disease, because levodopa can cross the blood-brain barrier, and in the dopaminergic neurons, levodopa can be converted to dopamine. Now, when we administered levodopa, it is best to give it with carbidopa. So levodopa plus carbidopa is more effective because carbidopa will prevent the peripheral metabolism or breakdown of levodopa. Okay, meaning there is more levodopa entering the brain, more levodopa present in the brain. Okay, so now when we talk about dopamine replacement, the most frequently tested points are: one is give it in combination levodopa and carbidopa. Second is there can be a wearing off effect. A wearing off effect means the levels of the dopamine or the drug levels will come down before the next dosage. Say usually the effect of levodopa is for about 4 hours, but within 2 hours the symptoms return. Okay, so this is known as wearing off effect. Second thing that is tested is protein can interfere with the absorption of levodopa. So the patient should be advised to take low protein meal or take this medication before a meal. And third, a very important point is you should not abruptly stop levodopa, because if you abruptly stop, it can present with neuroleptic malignant syndrome like symptoms such as sweating, tremor, fever, okay, and autonomic instability. So you should not abruptly stop this drug. So these are the key points regarding levodopa. Now moving on to the next drug, dopamine agonist. So dopamine agonist, what it does is it's an agonist. So it goes and stimulates the receptors to release the dopamine. Now with advancement of the condition, the disease, there might be the dopamine storage will be less and less. So this drug is only effective in the early stage of the disease, and also it is given to a younger age, patients in a younger age group who can tolerate postural hypotension and daytime drowsiness better. An example of dopamine agonist is Pramipexole and also Bromocriptine. Then we have drugs like monoamine oxidase B inhibitors. What this does is this prevents the breakdown of dopamine in the brain. So it prevents the breakdown of levodopa in the brain, and so it makes more dopamine available. Now we can combine levodopa with monoamine oxidase B inhibitors so as to get a relief from the wearing off effect. Why? It means you have more levodopa, the drug level stays a little stays before the next dosage. It doesn't become low. So this combination is effective for preventing the wearing off effect. The fourth type is the COMT inhibitors such as Entacapone, Tolcapone. Now the COMT inhibitors, they behave roughly similar to the carbidopa. They prevent the peripheral breakdown of levodopa in the intestine and in the peripheral tissues. So they're basically making more levodopa available. Tolcapone can be hepatotoxic. Now one thing about monoamine oxidase B inhibitors, whenever you hear that, the key point is there is a high risk of serotonin syndrome. So never combine it with other antidepressants, SSRI, SNRI. Okay. Now the fifth type is anticholinergic. So all these were increasing the dopamine levels or making more dopamine available. Now, anticholinergic will bring down the acetylcholine. Okay, so it will help in the balance between the dopamine and the acetylcholine neurotransmitter, and also it helps with the symptoms such as tremor, the fine resting tremor, the pin rolling tremor typically seen in Parkinson's disease, or the cogwheel rigidity. And lastly, you have a dopamine releaser, which is the Amantadine. Now, once again, Parkinson's disease, it is a neurodegenerative disease, but in the question, what are the clinical features which help you to diagnose? One is tremor, rigidity, bradykinesia or akinesia, meaning sluggish, slow movement. Okay, the gait would be sluggish, handwriting would be small, micrographia. They will have an expressionless face, that's called a mask facies. Okay, all the movements will be slow. That's all. Have a good day. Thank you.